Hello everyone, welcome to another episode of Two Health Talk, a show where we talk about real health challenges and get to break it down in a very honest and simple conversation. On today's episode, we have a very special guest. Why is this person special? Because I think we're answering the same name. I'm also Emmanuel.
Oh, really?
Yeah, I'm also
Ah, you
Emmanuel.
didn't tell
So
me that one.
also Emmanuel, and like Emmanuel are very special. Like yeah, we're special because we are few.
Yeah, we are.
Yeah,
Well, I
I think
think
I've
it's a
seen
very
few
common.
Emmanuels. I've seen.
I mean, I've seen a lot,
So,
really, but I think Emmanuel are special because the meaning of the name is
so
very unique.
so we have Dr. Emmanuel today in the house, and I'm very happy to have Dr. Emmanuel today.
Thank you for
Welcome,
having
Doctor.
me. Thank you.
Yeah, so
It's
if
good
you
to
want
be
to
here.
support what we're doing here and get to see more doctors, please like, share, and subscribe. Thank you. So back to Dr. Emmanuel. Um, when I was like making some like research about you, I noticed that you have a very, very like strong strong. Will I say strong? Which word will I use now? You have very strong words for sickle cell. That's why I was like, okay, I'm going to speak about sickle cell with you. So I want to know what's like inspired you to focus on sickle cell advocacy.
Well, first of all, I think it's something I even speak about a lot on my social media pages.
Yeah.
So the thing is, first of all, I'm a sickle cell warrior
Wow.
myself, yeah. So, and then being a sickle cell warrior and then being a medical doctor in the health space, it's just it just gives me the opportunity or the advantage to have like a louder voice. Like obviously being a health professional, when I speak about these things, people would obviously listen. And then being a warrior myself, where I have the experience firsthand. It's very easy to, you know, create the awareness and also encourage people that are also dealing with the same condition, right? So
Yeah.
obviously, it's easy for them to see and be inspired and say, "Oh, you're a doctor and you're a six-year warrior, so if you can do it, I can do it." That kind of stuff. I think that's what inspired me to the challenges we face with sickle cell, which people do not a lot of people know about. People are aware, yes, but it's not really out there as much as we want it to be. So yes, so that's those are the two things that really spurred me into like speaking about sickle cell and advocacy.
Wow. I like so when we're trying to like find out what we're going to talk about in sickle cell, because like I said earlier, your social media everywhere about you get to advocate for sickle cell. Even
As much as I can.
yeah. So like I'm trying to understand sickle cell triggers.
Okay.
Yeah, so people get to see sickle cell as one kind of a very, very bad disease. If you get to say, oh, this person is sickle cell, people just get to avoid them. And like I know that kind of triggered so many stuff both mentally and also can you explain like what's like sickle cell trigger is?
Oh, okay. Let me just say what sickle cell basically is. So sickle cell disease is like a disease of the blood. It's a genetic disorder, basically. So what that means is that the person that has the disease has probably inherited the sickle cell gene from both parents, right? So it's a genetic condition and it affects the bloodline, meaning that anywhere you can think of that there's blood in the body, sickle cell can literally affect. So it's not even just, it's way beyond just the person being in pain and all the all for things like there's so many things attached to it. Um, but there are a lot of, like you said, there are a lot of misinformation out there, a lot of rumors, a lot of myth about what sickle cell is and what sickle cell is not. People will say, oh, they die early, they do this, they that, sickle cell is transferable, all this kind of stuff. So that's one of the things we also try to advocate and speak about. Sickle cell is not, because I have sickle cell, I touch you now, you have sickle cell, no, it doesn't work that way. But concerning the triggers, now I believe you're talking about the crisis. So one of the commonest complication, one of the commonest symptoms or complication that people with sickle cell have is the what we call the episodic painful crisis. So they're always like in pain, not always in pain, but they get to be in and out of bone pain. It's very excruciating. There are other complications of sickle cell, but that's like the commonest one that we have in our society, the bone pain. And for the triggers, there are a couple of triggers that can tip someone into, a sickle cell crisis. Number one is stress. So stress could be any form, could be mental, could be physical, could be emotional. I have a patient that went into a crisis from excitement.
Wow.
So she got very good news and she was very happy. And the next thing, she started having an episode and brought her to the hospital. So stress, from any physical or whatever, like I mentioned. Another thing is also infections, right? So from malaria, could be a chest infection, and because of how it affects the blood, they're very prone to coming down with these infections. Then another thing is also dehydration. So that's why we always encourage them to drink a lot of water, because you drink a lot of water, it increases your blood volume, increases your blood flow. So you don't have, because the major thing happening there that predisposes them to the crisis is that there's a part of the blood vessel where those sickle cells have blocked, and so there's not enough blood supply, and then they start having that bone pain.
Oh,
So we call it vaso-occlusive crisis. That's the name for it. So that, and then I said dehydration, stress, extreme of temperature. So very hot and very cold weather. Not just very cold weather, very hot weather too can predispose them. And then what else again? Dehydration and then oxygen. Yeah, when there's low oxygen, we call it hypoxia. So when there's a low oxygen level, like in the room or in a place where there's no enough, because obviously your red blood cells, right? The cells require oxygen to be able to move freely and all of that. So that can also predispose them. So those are the common triggers that could
wow. So
push.
now, if for stress now, like for someone who gets like maybe Nigerian like on his own now is like stressful. So for someone that goes into this stress day and night, like what is your advice for the person?
So yeah, so when we talk about stress, I mean, you have to work, you have to do things, you have to make money. Nigeria is some boys are not smiling, the streets are not smiling. You need to make money, but you have to be conscious, about um for people that have sickle cell, they need to be conscious. It doesn't mean they cannot go to school. It doesn't mean they cannot, do jobs and all of that. All they have to do is that they have to be very conscious. Whenever they see that they are starting to, maybe they're extremely stressed and all, they have to be very intentional about their rest, right? For someone like me, I I think I work a lot, or maybe I used to, but now I try as much as possible to be very intentional. But one thing I do is once I see that I'm starting to not feel as I'm really stressed, I take breaks. Sometimes I might tell them I'm not coming to the office today, I need to rest, and I might use the whole day to just rest and get my strength back. So being intentional about your what do you call it, your rest, and then also protecting your immediate space. Like I said, the stress does it's not always might not be always physical, so emotional. So if you are, let's say, in a toxic relationship, or you have people that are not supportive or whatever, you just try to log out or detach yourself from that emotional stress, because those things can also predispose you into the person that has sickle cell into a crisis. So I think those are some of like the practical steps
Well, so
that
when
they
you're talking
can.
about stress now, me, I'm surprised that oh, a doctor and a sickle cell warrior, knowing that being a Nigerian doctor is one of the most stressful jobs in the whole world. How were you able to manage going to medical school, doing your house job, and being a medical doctor and being a sickle cell warrior?
All I can say that is God. But really, I think how I've been able to really cope and survive is that number one, I have a very good support system. So my family, my friends, and all of that, they're very supportive,
Oh,
right? And then my wife too, although
uh,
she's not here,
shout
but
out to wife.
she's also very supportive. So um right from med school days, I had friends where whenever I was sick, I had a crisis, I was on admission or whatever, they would run around, get me food, lecture notes and everything, all the slides, they'll gather all of those things, they'll bring them like maybe on a flash drive, and I'm able to like read them, while I'm on the bed or whatever. So they were very, very supportive. And even my lecturers and all of that were very intentional. Like they knew it wasn't something I hid from them, because my
Oh,
hematologist was my consultant. She was my lecturer too in
oh,
school. So it wasn't. There are times where I will even be on my clinic days. Some of my, because they knew my clinic days, they would tell me, "What are you doing here? Like, what are you doing on ward rounds or something? You need to go to your clinic." And also, they were very intentional, even down to my jobs. So I don't really shy away from telling them that because I'm in the health space. So you cannot discriminate me. That's
Yeah,
against the
true.
hair. So I tell
True.
them, and they're very aware. But as much as possible, I try not to allow it to affect my job. Some people I've seen a number of sickle cell warriors use it as an excuse not to work or not to do anything, or they use it as an excuse to call in sick, even when they're not sick or whatever. No, like I'm the kind of person that when I'm on the job, you know I'm on the job and I'm doing the job. So whenever I tell you that, oh, I need time off, I need time to rest and all of that, my superiors or whatever understand and they know that yeah, I actually needed time to rest.
Well, so like with this stuff you've said now, I've noticed that you've mastered on and you've identified your triggers. So for people out there now that have not identified their triggers, like is there any advice you're able to give them on how to identify their triggers?
Well, the triggers for sickle cell are like the ones I've mentioned, they're quite well known, right? So yes, for some people, some of these things, it's not all of them that will trigger you or that will trigger the person into a sickle cell crisis. Like for me, there's some things that, let's say, cold. I can literally stay in a cold environment for a while, right? But I still have to, regulate it. But it's not like the number one thing that'll put me into a crisis. My major trigger is stress. So I try to manage it as well as possible. But one of the things is that you need to understand and know your body. Like, for example, if it's that you maybe after you were exposed to an extreme cold weather, you started having crisis, then you know that most likely that must have tipped the person. So
Yeah.
understanding that and then trying to avoid, and then aside from that, not it's not that you're now focusing on only that trigger. You have to, for example, like I said, dehydration. So always drinking water, always being how do I put it, being intentional about your rest. Always, when as soon as you see that you have any other symptoms like a fever or whatever, you think you most likely might be coming down with something. Go get checked. See a doctor. Have your prescriptions or whatever. Have like your pain meds in handy, like your paracetamol and all of that. And then also, most importantly, have like a hematologist that you go to see every now and then. Because, like I said, the pain and the crisis is just one thing. There are so many other complications of sickle cell. So the earlier those things are picked, the better the person now gets, care and management. But sickle cell can be very financially draining. That's just the truth. Especially if you have to pay out of pocket. It's a lot. So that's why I said most of the time you save a lot yourself a lot of stress when maybe you're seeing your hematologist every month. And these things, I'm sure when you go to the clinic, the hematologist keeps reminding you,
Mm.
and then there are routine medications that are being given to the person to take. So once you're doing all those things, sometimes it might be inevitable. The person might have a crisis even after doing all of those things well enough. The person will still come down with a crisis for no good reason. Yeah, but whenever even the person has a crisis, the person has to go to the hospital to get care. So those things, by the time it becomes like a habit. It's like a lifestyle, and then you get used to it, and you understand your body very well. Avoid all those things as much as possible, and you might just see that the frequency of the crisis has reduced.
What about managing psychological stress?
So, like I said, for psychological stress, try as much as possible to especially your immediate space, as much as possible. Anything that is stressing you psychologically, try to just make do with it. Sometimes you need to take, for some people, because of what is going on the internet, because of the badness and everything, some people it gets to them easily, and that can make them maybe sad or have a be in a depressed mood or whatever. And if that's how it works for you, then maybe you should take a break from like social media and just not be in that space where you are getting maybe bad news or whatever. Or if it's maybe a friend or somebody that is stressing you out emotionally or mentally, just try to, detach yourself and save yourself the stress. I mean, this is something that every other person
As you
should do.
know, yeah.
So, or
Well,
you have to do it consciously
fortunately.
because the person has sickle cell and that can tip the person into
Well,
it.
so for children with sickle cell now, like, is there any advice you can give to their parents, maybe from your experience that, oh, you're able to manage their crisis this way, or you're able to manage their triggers this way, or you're able to identify their triggers this way?
Yeah, so for kids, well, I think one of the first things I'll tell their parents is as soon as you know that your child has sickle cell, look for a sickle cell clinic around you or a hospital that has a hematologist and register the child immediately to see to be seeing the hematologist every month or something, right? So, because there are even some like investigations we carry out for those kids too, just to know their steady state, and then also look for how to see ways to manage them so that they won't have complications in the future. But if it's a child that is always starting to have crisis, same thing. See the hematologist, there are medications that the child has to be on to help reduce like the frequency of the crisis. So that's one thing I advise to them. Um, Make sure you register in a sickle cell clinic or belong to a support group. So we have a lot of support groups because I work with a couple of sickle cell foundations where they've created a community where you have warriors, you have their parents and caregivers that are on the group, and they're able to like find like a safe space where you know they can come and say, oh, this is what this is, my child is not this, what can I do? And then we give advice, oh, go and do this, or visit the hospital and all of that. And another thing you need to do is you should try as much as possible to also create an environment where that child can thrive in. Because of some people and the mindset, oh, this child is going to die soon, they try to limit the growth of that child, which is not very good. Like, oh, maybe because you feel the child has sickle cell and everything, the child says he wants to study medicine or something, they say, it's too stressful for you, you cannot do it. And that kind of stuff. Obviously, it creates a mindset in that child that he or she cannot amount to something.
Yeah,
So,
true.
but when they try to encourage the child that no matter how hard it is, right, or if they think it's something that is too extreme and they cannot listen, they can advise, and then whatever the child's decision is, just create a space. Some will say, oh, don't play too much, oh, this one, this one, this one. Yeah, but everything should be done in moderation, but don't now cage the child or limit the child, and the child cannot go out and play with kids, or the child cannot, then the child grows up to become like socially withdrawn or socially abnormal or something, right? Because he or she thinks that, oh, he has a condition that is very bad and all that. And then they should also make their research and read more about sickle cell so that they are very aware, right? Like this month now is sickle cell awareness month, and you have a lot of content going on in social media and everything,
Mm.
how to manage this, how to do this, how to support someone living with sickle cell. So those are things that they should try and consume too, so that it helps them understand the condition better. And then they should ask questions, right? That's why we have the support group. That's why we have them going to see the hematologist so that they can ask questions. And whatever fears they have, it can be allayed. Like they can have the reassurance that, oh, my child is not going to die very soon. So far, there's proper treatment and all of that.
So I even forgot to ask you, Seth, growing up, were you going to like be a doctor? Is it already on your head that you're going to be a doctor growing up?
My brother,
Like you're already saying,
that
even
question.
yeah, were you like, oh, I was going to be a doctor.
No, I never wanted to be a doctor. I
So what pushed you to
never
study
wanted to be a
medicine?
doctor. I think it was more of like parents, you know, it was mostly my mom, really. In Nigeria, there's this general belief that, oh, you have a child, the child is brilliant, the child is doing well in school, and child is like top in the class and all of that. The next thing is that you go and study medicine or engineering or law and all that. That's how it is. So I came from a family where we have like a good number of doctors and all of that. So it was
Oh,
just like, yeah, doing well in school, yeah, doing well. I used,
so nobody was like saying, oh, you're a sickle cell warrior, you don't need to
they
study
were even
medicine.
pushing me.
Oh,
That's the thing, they were even pushing me. So that's why I said I have always had like a very good support system.
true, yeah,
They were
true.
pushing me. Like my mom literally was like, "Oh, study medicine." My grandfather, my late grandfather, was ready to like sponsor my whole this thing. Before he died, he was even sponsoring my education. He was like, "Anything you need, if it's
Wow.
the money, if it's whatever, I'll give it to you, just to make sure that I had like a very good experience in school." So yeah, so nobody hindered me. Oh. I feel like the only thing I probably have not been able to do that has hindered me with like as regards sickle cell, maybe join the military,
Oh,
which is not allowed. Otherwise, it was
oh,
allowed. I would
true,
have joined.
true,
So
true.
that's it for me. But I never wanted to become a doctor. I mean, here we are
Yeah, saving lives now, giving out the good
at the
message.
expense of my own life.
So, lastly, before we leave, like, what's your general advice for with caregivers, parents, and those looking after sickle cell warriors?
I think basically what I'll just say is sickle cell is not a death sentence. And people think because you have sickle cell, it's all over for you. You cannot do anything. No, sickle cell is not a death sentence. As a matter of fact, I'm this kind of person that I'm a strong believer in whatever situation you are in, you should be able to, it depends on how you see it. We have like the optimistic people, we have the pessimistic people. The pessimist will think, I'm in this situation, I can't do anything and everything. While the optimist is positive minded and looking for how to use that situation to either better himself or herself or people around him. Which is one thing I have done as regards sickle cell advocacy. There's some people that will just say, I have sickle cell, I'm depressed. They just lock up in their house and they're not doing anything and all. But sickle cell is not a death sentence. And there are people that, aside from myself, the people that have sickle cell and even worse disease conditions that are doing very great things, right?
Wow.
So, yeah, you have a disease condition, whether sickle cell, whether diabetes, whether hypertension, whatever it is, you can still do something great with your life,
True.
within your capacity. So I think that's one thing, I try to tell people anytime I have to talk about sickle cell, that
Wow.
anything you really want to do that is within your capacity to do, do it.
I just remembered my friend now. There's one of my friend that his name is also Emmanuel. May so rest in peace. Emmanuel is a sickle cell warrior. And I knew Emmanuel for up to 6 years. I never knew he was a sickle cell warrior. Like he kept it this cool until by this time last year. I traveled to Lagos and they called that, oh, Emmanuel is in the hospital, blah, blah. And that was when I found out that he was a sickle cell warrior. And he was living his life normal. We're going out for lunch, going out because we work in the same office. And I was working in one office then, we'll say he was the operations manager. He was very, very active, very detailed to his job. And you will not even know that he's sickle cell. His thoughts just flashed back now to my head. And, I want to say, may he so continue to rest in peace. He was like, he's a very great guy. To me, I know people that knows him very well. Like, the man is one person that I would say if there are 10 in a room and I want someone to talk about me, Emmanuel will come out to talk like, okay, Raymond is like this, Raymond is this way. Like it's just one like best guy that like I've ever crossed in my life. So rest in peace. Just feel
Yeah.
somehow now remembering me
Yeah.
now.
No, no, I mean, I you see that's why I tell people that whatever it is, while you're here on earth, just make the best use of it
Sure.
and connect with people, be happy, just do what you want to do. That is right by yourself and by God, so that everybody's going to live. Whether you live at age 90 or 20 or 30 or whatever, it's everybody will leave at a certain time, but it's after you've left that whatever it is that you have done on it, that is what people like. For example, see, you're talking about him, and I've not met, I've not had the privilege to meet him, but with the way you've spoken about him, I know that he was a great person.
Yeah,
So
very
yeah,
great. Most of the gig I get to like have then as our last year, Emmanuel will go into a place and they're talking, oh, they need someone to do this thing. And he'll say, I have this guy. He can even the one that cannot do, Emmanuel will say, this guy, he can do it. So he's that kind of guy. And I just felt so bad that when I started this channel
yeah,
and this show, he's not here. Because I know he's one of like my biggest supporter.
support as well.
Yeah. So
Yeah,
rest in
so,
peace.
amen,
Yeah.
amen.
Thank you so much, Doctor, for coming on the
Thank
show.
you, thank you, thank you for having me.
I really appreciate. You doctors are very, very busy. To have one doctor on the show
Eh,
takes a lot.
wow.
Yeah.
Okay. Thank you very
Say,
much.
even you
Thank
now,
you.
was it not last week? We were supposed to come and say, oh, you had this file,
Yes,
let's push
yes,
this
yes,
one. Like,
yes, yes. Our schedule can be quite hectic, but
yeah.
find time.
I used to even, like, I'm surprised how you guys survive.
We're humans too now. We're humans now, so we have to look for a way to survive. But
Yeah,
yeah,
yeah. Thank you so much, Doc, once
thank you very
again.
much. Thank you very
Yeah,
much.
we've come to the end of today's episode. For us to get to see more doctors come on board, please like, share, and subscribe. And thank you for watching up to this moment. Bye.